it's also a very important topic. The air we breathe, which affects every one of us, each and every one of us. So we'll have a little discussion on the air pollution, which is a challenge, and there are a lot of unmet challenges when you try to address this air pollution. So we will briefly discuss about this very important topic. Okay, yeah. Why every doctor needs to know about air pollution? Of course, it affects each and every one of us. Outdoor and indoor air pollution are extremely common, and it is very under recognized major health concern, especially the indoor air pollution. We'll talk both about outdoor and indoor air pollution. Restoring clean air needs extensive community awareness because no government or policymakers can individually do like restore clean air. It needs a lot of support from people, a lot of awareness among the public, and a lot of motivation from the public. Otherwise, this won't do. So it's very important that doctors who have a major role as public health educators and leaders in the society need to be aware of about both indoor and outdoor air pollution. And also, air pollution is a root cause for many disorders. So when we see our patients, it's also important that we encounter this problem and we openly discuss this problem of air pollution. So on average, a person inhales about 10,000 liters of air daily. So you can imagine how much of air that we daily inhale. And polluted air is an invisible killer across the globe. There are 8 million premature deaths per year. And of course, the global life expectancy reduces by 1.8 years because of air pollution. And there's a huge cost involved in managing health disorders related to air pollution. And also, especially for us, both low and low middle income countries, including Sri Lanka. About 89% of these premature deaths that we mentioned are happening in these areas, and especially Southeast Asia. So it's very relevant to us who living in the Asian subcontinent. So we'll briefly discuss about what is outdoor and indoor air pollution, how to identify, what are the constituents of the air pollution, and what are the sources, and what are the health effects, and what are the challenges in restoring the clean air. Okay. So what is air pollution? The definition is that any chemical or physical change which results in a change in the constituents of air, which can be brought about by natural or human activities, which ultimately result in degradation of the air quality. So when we talk about constituents of air, there are a lot of things that we discuss. There are gases and non-gases. So among the main gases, ozone, carbon monoxide, sulfur dioxide, and nitrogen dioxide. These are the four main gases that we always discuss. And actually, these are the gases that we check also when we discuss about the air quality. But also there is volatile organic compounds, which is again gaseous constituent of air pollution. Then there are non-gaseous other particles, especially what we call particulate matter. So PM, we call it PM, particulate matter, PM 2.5 and PM 10. So PM 2.5 is the small particulate matter which are of micrometer 2.5 diameter. 10 is micrometer 10. Then also there are lead particles and black carbon particles. All these are constituents of air pollution. But the ones circled here, the particulate matter and these gases are the ones that has been commonly measured from air quality sensors. However, these gases measurements also need very sophisticated equipment. So what is usually measured is the particulate matter. So there are WHO guidelines, air quality guidelines, which were established in 2005 and also revised in 2021. We can see that most of the cutoff levels have come down. So we are more trying to achieve more clean air because people have identified that air pollution is a major health risk factor. So we try to achieve more and more clean air. So the particulate matter 2.5. So the average 24-hour the cutoff or the guideline says it is now 15 micrograms per cubic meter. So likewise, there are cutoff values for each and every constituent, as you can see in this graph or the table. So why is this particulate matter is very important? Because one thing is it is very frequently measured, and also it's very commonly seen in dust, smoke, and soot. So there are a lot of human and natural sources of particulate matter, and these particulate matters are the ones that can go into our bloodstream and can cause a lot of human diseases, as we discuss in the next few slides. So when you talk about particulate matter 10 in your let me take this pointer here. Yeah, here you can see about 50% of particulate matter 10 come from dust, from natural dust. So it can be like this sandstones or other natural dust, or even can be from the construction work. However, the remaining ones are from the man-made resources or the man-made sources. However, when you look at particulate matter 2.5, you can see dust only contribute to about 10%, whereas 50% comes from waste burning and fuel burning. You can see it is transport. Transport is from burning of fossil fuels, and also from solid waste material burning. So it's 50%. And also remaining ones also here, you can see domestic cooking, diesels, and industry. So about 90% of particulate matter 2.5 comes from uh, human activities. So it's very important that we identify particulate matter 2.5 is a major constituent which can be resulted mainly by the human activity. So that is why it's very important. It's a good representative measurement of human activities that can cause air pollution when you compare with particulate matter 10. So sources of particulate matter, as we discussed, there are this vehicle fuel emissions, industrial emissions, then see here from household cooking, and also natural sources like volcanoes and sandstones from in the deserts. So likewise, there are natural and human phenomena that can cause particulate matter rise in the environment, but mainly it's from the human activities. So once you know the particulate matter, or for that matter any other constituent, the concentrations, you can calculate the air quality index. So this air quality index is very commonly used in measuring air quality or comparing air quality between cities, or as a guide. So you can see now even in Kandy there was this, in the Torrington Square, if you can remember, there was this air quality index some time back. Still there's these sensors are there, so they are constantly measuring the air quality, the particulate matter concentrations in the environment. So, and based on that we can calculate the air quality index, which is, if it is 0 to 50 it is good, it is green, up to 100 it's yellow, that is moderate, and above that it is unhealthy. So there are again grades like orange, red, purple, and maroon. Maroon is 300 plus, so that's very unhealthy, and most likely it's hazardous. People can't live in that much of air quality. But there are some cities in this purple category, very unhealthy air quality index. So this can be calculated for any matter, any gases or particulate matter, but commonly it's calculated for particulate matter 2.5. So if you look at the 2018 WHO global ambient air quality database, so these were the cities which had highest air pollution. There's a globally world, Lahore, Pakistan, and there were some cities from Poland. Poland is apparently the second most polluted, currently the second most polluted in the Europe, second to Turkey, but in 2018 it was the highest in Europe. And then there are Bangladesh, India, Saudi Arabia, and some other Asian countries. So what's the current situation? This is the online ranking. This is actually today's ranking. You can see, sorry about the small print, but these are the most polluted cities. You can see India, Pakistan, Vietnam, Egypt, and Mongolia. So most of the Asian countries are there. And what are the cleanest cities? New Zealand, Australia, USA, Canada. So some cities from these countries. So where do we stand as a country, Sri Lanka? Within the Asian subcontinent, we are actually a high performer. So we can be proud of that. Our air quality index for 2.5 particulate matter is 20.9, so 21. That's the annual average. So it's below 50, which is a good sign. When you compare with India, which has 167, Nepal 156, you can see Bangladesh 190. So we are 21. We are doing much better, but there's a lot of room for improvement, as you will see. So that's the average, right? But if you look at the today's values, this is today at 8:30 in the morning. You can see Candy. We had then AQI of 63, which is above 50, so it's moderate. Especially PM 2.5 was 3 times higher than the cutoff of 5, which is 15. So always we would be happy to compare with Colombo. So I looked at the Colombo values also. It's again moderate, higher than Candidate's 98, and the particulate matter is 34, which is about 7 times more than the upper limit. So there's a lot of room for improvement. So what are the main sources of air pollution in Sri Lanka? It's 60% or more would come from the transport sector, that is the vehicles, the traffic congestion, poor vehicle maintenance. So that sort of, the factors would constitute for about more than 60% of air pollution. Then industrial air pollution, domestic air pollution, which is again a very important cause, even though under recognized, and also transboundary air pollution. If you can remember, a couple of years back, there was a lot of fog in Colombo, which we thought that coming from India, because of there's a residual burning, the agricultural burning happening in India, and all those the fumes, they cross the boundaries, and there is transboundary air pollution. Then also there are accidental fires and forest fires. But out of these things, the main thing would be transport, the transboundary effects, and the industrial and domestic air pollutions. So we talk about outdoor and indoor air pollution. So outdoor air pollution, the human activities, combustion of fossil fuels like for transport and other factory reasons. Then emissions. So emissions from industries and factories like carbon monoxide, hydrocarbons, sulfur dioxide, and also from construction industry. There will be a lot of particulate matter released from the construction industry. So Professor Ile Peruma from University of Peradeniya, he has been very instrumental in identifying this air pollution problem. He has been a pioneer in raising awareness in air pollution. So this is one of his studies where he has demonstrated that during the course of a day, how the air pollution varies in the city of Kandy. So you can see that during the peak hours where you expect to have a lot of traffic congestion, how the air pollution has gone up. So that's a very constant effect, as you can see here, for almost all constituents of air pollution: nitrogen dioxide, sulfur dioxide, carbon monoxide, ozone, everything. So this ozone, when it is in the outer atmosphere, we know that it's a protective thing because it reduces the UV rays coming in. But when it is in the low atmosphere, it's a harmful because it's an oxidant and it can cause lot of human diseases. So ozone is an oxidant and it can harm the human health. And also in the same study, Professor Iloprum has shown that during 1 year, how the air quality changes. So this is in 3 separate years that you can see. It follows the same pattern: 2018, 19, and 20. You can see there's high air pollution from somewhere here, from October to March maybe, and from after March to September, there's low air pollution period. So that has been a constant effect. And if you can see in this map on the right hand side, we know that our northeast monsoons, or whatever the wind from the northeast side is from December to February. So it would nicely correlate with the high air pollution. So you can see here from December to February, the air pollution is the highest. So probably how the transboundary effect affects the air quality of a country. So this is a classic example. So of course we know that COVID, one good thing of COVID is that it has a major impact on the air quality globally. And this is China before and after COVID. During the lockdown, we can see the nitrogen dioxide levels has drastically reduced. And also it was hot news that from Kathmandu, they were able to see the Mount Everest, some 250 kilometers away. So that was after many decades. People could not see it for a long time, but with the lockdown, there was much cleaning, or the cleaning effect of air. So that is how the human activities have resulted in causing air pollution. What about the natural phenomena? Volcanic eruptions, forest fires, lightning, and sandstorms. These are the main phenomena that can cause air pollution. That is outdoor air pollution. So this outdoor air pollution invariably it will have an effect on the indoor air pollution also, because we know that in a household where which is by the side of the side of a main road would invariably have high air pollution than a household which is at the village or a a rural area. But then it's not only the effect of the outdoor air pollution. There are a lot of other activities that happens indoor, which results in indoor air pollution, especially the kitchen activities, the kitchen, the burning of biomass fuel, the kitchen location and the ventilation, and how the whether the kitchen is separate from the house or within the house. All these things matter when it comes to indoor air pollution. And also there's this burning of this solid material like incense sticks and mosquito coils, which also cause a lot of these solid burning can cause and can release a huge amount of particulate matter. In fact, it says that one burning of one mosquito coil would release particulate matter 2.5, which is equal to about burning 75 cigarettes. So that's a huge amount. And also we know now these there's very little standard maintenance when people manufacture these things, especially these incense sticks. They are coming from, they are usually they are these home industries, even the mosquito coils, and there's very little regulation, and we don't know what are the things included in these solid material. So with burning of these, there's a lot of indoor air pollution, which is very under recognized entity. But of course, when it comes to many health effects like respiratory diseases, we always ask about this air pollution. That is something that all doctors need to be aware of. And also when it comes to kitchen fuel, so apart from the usual firewood, there are some communities, they burn plastics, polythenes, which can cause a lot of air pollution. So some people are not just aware, people are not aware of that. And also there's waste material, waste residue burning. So all these things are unhealthy, and there are people need to be aware of that, and as doctors we need to help educate them. So this is a very important issue, that indoor air pollution is very under recognized even to this date. Okay, so that's about some introduction about the outdoor and indoor air pollution. So what are the health effects? So health effects of air pollution can be short term or long term, which we will discuss. Out of the long term effects, so if you take individual diseases, stroke and ischemic heart diseases are the highest, uh, the diseases that can have highest impact from air pollution. So out of strokes, they say that the health impact of air pollution can be as high as 34%, and for ischemic heart disease can be 26%. So then comes the respiratory diseases like COPD and chest infections, lung cancer. But if you consider, if you take them as one group, one respiratory group, of course they can overtake the other cardiovascular and neurological diseases. But usually this is how we see. So stroke, ischemic heart disease, and other respiratory diseases are the highest affected health disorders from the long-term exposure to polluted air. In fact, it says that people do exercise in the open areas. In 2017, in 2017, they have declared in London that the exercising in outdoors, the benefits are negated uh, from the effects of the air pollution. So they have advised not to exercise, not to jog in the outdoor in the main, the main roads. So they have, they identified separate rural areas and other roads. So that was a public concern a few years back. What about in this is some study that we have done in Kandy, where in 2022 or 2023, where there was this high and low air polluted seasons because of the transboundary air pollution effect. So we just looked at the number of admissions, acute admissions because of the respiratory diseases. We just looked at the hospital records, and there was this. You can see during the high air polluted season, this season, and this is a low air pollution season, there was a significantly different or significantly high number of respiratory admissions to the Kandy and Peradeniya teaching hospitals. So the conclusion was, compared to the lower ambient air pollution period, higher increased hospital admissions were observed among those aged above 65 years. And males, where you would see COPD and pneumonia admissions were significantly higher during the two periods. So this is the high air pollution period and low air pollution period, and the respiratory admissions were significantly different. So when you talk about the constituents of air pollution, so particulate matter would be the highest constituent that affects the human health, but also carbon monoxide, ozone, nitrogen dioxide, sulfur dioxide, and lead. So all these would have their fair share of impact on the human health. So what is this particulate matter? So this cylinder you can see here is a human hair. So it's a magnified human hair. So when you compare to the human hair, this blue one is the particulate matter 10, so which is have a diameter of 10 micrometers, and this red dot is the particulate matter 2.5. So you can imagine how small, how tiny is this particulate matter. So this particulate matter, they can when we inhale them, they can actually cross the alveolar barriers, and they can actually enter the bloodstream. So that is where the danger lies. So with the chronic air pollution, once this particulate matter enters into the bloodstream, they are engulfed by the macrophages, which then initiate the whole cascade of inflammatory process. So as we know, this chronic inflammatory process is the basis. It's a common basis for many human disorders. So there are these activation of a lot of endotoxins, chemokines, interleukins. So there are a lot of inflammatory mediators, and then there's activation of the T cells, eosinophils, and ultimately there will be a lot of oxidative stress and phagocytosis and chronic inflammation. So this affects not only the respiratory, so there can be respiratory effects like emphysema, but also, as you can see here, there can be strokes, a lot of cardiovascular remodeling of the blood vessels, the vasculature remodeling, airway remodeling, lung cancer. There can be activation of carcinogenesis. The carcinogenic genes can be activated, chronic respiratory infections, and also other diseases like diabetes and heart diseases. All can go up with chronic exposure to this air pollution. Acute effects. The short-term effects are mainly because of the irritation and allergy. You can get cough and acute respiratory, infections and irritations, eye, nose irritations, skin irritations, and other allergic disorders. But it's mainly the important ones are these long-term effects of exposure to particulate matter 2.5. So if you look at the global literature, it is well established. The relationship between the air pollution and these disorders are well established. There are a lot of studies, mainly for these respiratory disorders like asthma, COPD, pneumonia, lung cancer, all these things, interstitial lung diseases. Now there are a lot of growing evidence that air pollution is one of the main and the most important risk factor for most of these disorders. Also cardiovascular disorders like myocardial infarction, then strokes, high blood pressure, and other arrhythmias. Not only that, gynecological disorders like increased miscarriages, placental dysfunctions, and other pregnancy adverse effects. See here, the IUGR, gestational diabetes. So there are a lot of relationships with exposure to outdoor air pollution. Then there are other pediatric diseases, including autism, immune dysfunction, inflammatory bowel diseases, obesity and overweight, mental disorders, dementia, depression. So there are a lot of associations, and all these are like if you look at the published data, you can find these things. A lot of dermatological associations and other surgical diseases also, as you can see here. So what about our own studies? In Sri Lanka also, there are a few studies that people have done, especially about respiratory diseases. It is well established that acute wheezing and chronic asthma and other respiratory disorders can be increased with the exposure to outdoor air pollution. These are mainly among school children. In Colombo and suburbs, they have done a lot of studies, and also one of the main study that when we talk about asthma in children, we talk about this ISAC study, that is international study on asthma and allergy in children, which is they have also looked at air pollution, but they have not established a direct relationship with air pollution and asthma, but it's a good eye opener, which has demonstrated that in Sri Lanka, you can see there's a star here, which implicates that This star says that there is more than 20% wheezing among school children aged 13 to 14 years. These aged 13 to 14 years school children, the wheezing is, they're not diagnosed asthma, but they're having wheezing. So some of them are obviously having asthma. So the prevalence of wheezing is more than 20% in some areas in the country, which is very high. You can see there are some other areas also where there is more. There are a lot of stars here and there, but it is considered a very high prevalence of wheezing among school children. So this ISAC study, what was done, it was done in multiple centers in the country among two age groups, 13, 14, and 6 to 7 years. So it's a very good eye opener. So most of these children might be exposed to outdoor air pollution and indoor air pollution, which can be the root cause of this high prevalence of asthma. And also, there are some local studies which have done among pregnant ladies. It's a questionnaire-based surveys. So more exposure to biomass fuel for cooking has a relationship with adverse fetal growth. And also household air pollution from biomass fuel, the kitchen fuel, kitchen smoke exposure can also cause adverse fetal growth outcomes in rural Sri Lanka. So there are these studies which has happened, which people have conducted in the country. So we have some evidence about respiratory disorders and pediatric disorders in Sri Lanka, but of course there's a lot of room for other studies like cardiovascular, dermatological, surgical. We don't have much evidence for the country, but when you look at the global literature, all these things are there. Then there's this new interest about plastics. So people have been talking about plastic pollution for about now 2 decades, but it is mainly about the soil and water pollution, because plastic bottles people throw everywhere. There's a lot of soil pollution and also water pollution. But now people are also talking about plastic related air pollution, which is something new. People are talking since recently. So so that's called microplastics, because now there's a lot of plastic burning happening now. Of course there are a lot of regulations for that as well, but still people burn these waste residues including plastics, and which can release microplastics into our environment. So these microplastics, there's a possibility that they can have a lot of health effects, including hematological malignancies, other cancers like brain cancers, breast cancers, then neurological effects and lung cancers and interstitial lung diseases, a whole list of disorders as you can see here. So this microplastic is also a new topic that is being discussed. And interestingly, if you look at the world, what are the 5 heaviest plastic polluters? Of course, Sri Lanka is there as a number 5. So China, Indonesia, all are Asian countries. And these 5 countries, they contribute to 56% of global plastic waste. So this is an area where we need to, concentrate more, and we need to act more. Okay, so so we have discussed what is air pollution, what is outdoor air pollution, and what are the human activities that can cause outdoor air pollution, what are the common health effects. Then what are the challenges we face when we try to negate the effects of air pollution, or when we try to counterattack this air pollution. So there are a lot of commendable activities that has taken place over the last several years. One of which is obviously the establishment of Central Environmental Authority in 1980. So this is CEA. It was from a separate act under the Ministry of Environment. So that was in 1980. So, and after that, there have been a lot of activities, or a lot of commendable, decisions that has been taken. From in 1987, this crocidolite asbestos was banned in the country, which can cause a lot of lung diseases, including asbestosis and mesothelioma. Then 1994, in Sri Lanka, the government has defined the air quality standards, and what are the standards that has to be achieved in each of these cities. Then Malé Declaration, and we have been a partner in the Malé Agreement for Transboundary Air Pollution. So it is still in effect, but of course there are limitations. Then Environmental Protection Act was established in was uh, has come into act on in 2000. In 2000, then there was this vehicular exhaust emission standard. So now, as we all know, it's mandatory that when we take the vehicle license, we have to get this what you call this vehicle exhaust emission standard certificate, or what we call the Duminda. So that is a mandatory requirement which has come in 2003. Again, it's a very good step, but still there are a lot of loopholes and a lot of room for improvement in that as well. In 2008, there was this amendment to these air quality guidelines and the ambient air quality standards. So likewise, there have been a lot of improvements. In 2015 also, there were legislations regarding asbestos roofing sheets, and also there are some legislations for plastic control, use of plastic material. The Central Environmental Act, which came across in 1980, has very important legislations. They talk about transport sector, the fuel standards. So, what are the fuel qualities that should be imported to the Sri Lanka, and also the standards of the vehicles that should be important, like two-way engines were banned, and then you cannot import the vehicles registered after 5 years, like the manufacturing year should be within 5 years of the registration. So likewise, there are a lot of important things that is mentioned in this Central Environmental Act. And also about the industries, there are a lot of regulations for the industries, and also about the air quality standards. And also it mentions there are some guidelines for indoor air quality. Also, we have to understand that this indoor air quality, we cannot have legislations for indoor air quality because it is something that cannot be monitored. Of course, the things that can be monitored is that when you build houses, of course there should be some standard. There are standards regarding the ventilation and lighting, but however, what people use for kitchen fuel or the burning, of course these things cannot be regulated. So what is important is uh, the awareness. The public health awareness is very important when it comes to indoor air pollution. So all these things comes under the Central Environmental Act. And also there are other acts in the country which talk about, for example, this Urban Development Authority law, which talks about this indoor air pollution, then the two-stroke vehicle banning. So likewise, there have been a lot of legislations and activities. So probably we can skip these few slides, which also talk about this particulate matter, the cutoffs and the legislations. Then we come to the what are the things that we can implement to overcome this air pollution. So control of vehicle emissions, because 60% of our air pollution comes from the transport sector. So how can we improve that? Eco-friendly transportation is very important. Effective public transport systems, electric vehicles, then moving to lower emission road vehicles like electric vehicles and other, hybrid vehicles, and of course, addressing the traffic problems, the traffic jams, and separate bus lanes. So all these things come into play when we talk about this controlling the vehicle emissions, and also like more uh, eco-friendly transport models like walking and cycling. So of course, this is Peradeniya cycling team headed by the previous director, and improving road infrastructure. So there are a lot of improvements that has to take place. So these things won't come naturally. So as as the public, we need to be aware of these things, and we need to talk about these things, and we need to uh, motivate the government, and we have to work towards these things. And also driving restrictions, there should be high congestion zones, especially these there should be time limits, like we can in other countries there are taxes for high congestion zones, especially close to schools. Now we know all our schools are there are a lot of congestions near the schools. uh, so if you look at the lung growth, The maximum lung growth happens in the first 2 decades of life, so up to about age 20. So after the first 20 years, actually there's no lung growth. So it's very important that our children achieve the maximum lung growth during the first 2 decades of their lives. But when they are exposed to this high air pollution in these high congested zones, they don't achieve the maximum lung growth, and later in life they can have respiratory disorders like COPD and asthma. So it's very important that near the schools, the traffic congestion should be minimum. So for these things, there should be a well-planned system. So low emission zones can be applied. So taxes can be applied. So there are things that the policies that has to be taken. Then again, from the industrial sector also, there are a lot of sulfur control technology, the ammonia emissions. So these things also need to be introduced. There are some regulations in the Central Environment Act about these things. Then, of course, when it comes to the indoor air pollution, people need to be aware about this solid burning. So when it comes to incense sticks and this firewood burning, people need to be aware how best to do it. They can have outdoor furnaces. The kitchen can be kitchen can be separated from the house, or there can be other ventilatory methods that can be taken. And also people can switch from improved from this open burning of the firewood to improve furnaces. Like there are devices, there are kitchen stoves that minimize the air pollution. So likewise, and the chimneys and the ventilation, all these things are very important. So there needs to be a lot of awareness among the general public about these things. So of course, then ultimately we need to talk about this renewable fuel and the clean energy production, solar and hydropower, and to minimize the use of solid fuel burning. So energy conservation and efficiency. So all these things become very important when you talk about uh, uh, transforming energy to clean energy production. Okay, so with that, I think I have come to the end of my talk. So what we have discussed today is air pollution is a major public health concern, and especially in the low and middle income countries, because of the poor economy, people use a lot of solid fuel, the biomass fuel, and also there are a lot of issues related to transport, so which is a major constituent of air pollution. Restoring clean air needs international, national, regional, and individual commitments. So, as doctors and as maybe leaders in the society, we need to be aware of some of these things, because where we can pressurize our government is from the health, uh, because we are a group that can always talk about air pollution and human health, and the government and the other policymakers will listen to us because that involves human health. Uh, so I think we need to take up this role as educators, and also we need to motivate our policymakers to take some of these important remedial actions. So developing countries we need research to determine our priorities, and also we need activities to improve the public awareness, and also we need to identify control measures and develop special strategies. There need to be a lot of political commitment, and we have to be part of these groups to develop national action plans and legislations. So air pollution, the challenge to overcome the challenge, there need to be a lot of teamwork. And I think with that, I can conclude my talk, and thank you very much. Yeah, sorry. Of course, yes, because now there are a lot of non-governmental organizations and public groups uh, who are involving in this reforesting, and also because uh, with this replanting programs, of course, the air pollution goes down. because especially we know that carbon dioxide, the levels can go down, especially. And also I think that would now we see even in the Candy City there are a lot of this replantation is going on. So I think when it comes to the gases air pollution, there's a lot of there's improvement, especially when you take the carbon dioxide. But when it comes to particulate matter, we need to address the main concern, which is the transport and the indoor burning. So yeah. Uh, yeah, it's you've been it's very difficult to yeah. I'm not exactly sure whether it's for a unit area, but I think it's also the how much we contribute to the to for this soil and water pollution with the plastics. So probably because being an island, I think there's a lot of plastic pollution going on, which we are also not aware of. So I'm actually not sure how they have categorized that, but I think it's a like overall measurement, not for a unit area. But I'm not exactly sure. Yeah. Mhm. The global animal husbandry. Whether that contributes to the air pollution. Now, for example, what happens is now if you look at India especially, when it comes to India pollution, they burn this cow dung as a major fuel source. So in India, there's a lot of India pollution when you compare to our countries, other countries, because there are cultural differences. I'm not sure now. Of course, these residues can, if they burn these residues, I think that would contribute to a lot of air pollution. So animal husbandry and cattle farming, I think what would better there is mainly the how they get their waste disposal. If there's a lot of burning, I think there can be, but otherwise I don't think it's a major concern, because none of these articles that we read discussed about specifically about this cattle farming and all. But of course, that was this cow dung using as a indoor, the kitchen fuel. It has been discussed. Yeah, and especially sulfur dioxide. Yeah. Yeah. It's because of the all right. Hmm.
So some plants can do oxygen even in the night. It's possible to kind of important.
Yeah.
But I also read a little that it says sometimes some plants capture oxygen during the daytime and release in the night. Is there anything like plants can be recommended? Cannot be recommended.
I'm not like read specifically on that, but what my understanding is most of the plants should be kept outside at night. So that is what I have, my what I have learned and I have come across. Because during the daytime, yes, it can produce the oxygen, but during the night, it's not going to improve the air quality. But I don't know whether there's any other answer to that question. It might also depend on the size of the plant as well, isn't it? The large plants would constitute more oxygen in the night. Uh, so I have not come across any, not specifically read on that. I don't know if I can contribute to that.
spend a significant amount of time traveling from home to hospital, and we spend a lot of time that to the air quality using air conditioning. What role does the air filter are there studies that those air filters how wider varieties of particles?
Yes, now this they would filter out the large particles, maybe even up to, I don't know the exact size, but this soot and dust particles can be filtered out, so that's important. But these tiny particles, PM 2.5 and this very small, even we are talking about PM 0.1 also, very tiny particles. I don't think the usual air filters, even the I don't think even there are very specialized industrial masks to filter those things. But general air filters, they want filter these very tiny particles. But for general soot and maybe larger particles, PM10, I think it might have an effect on that. So, and it's important, as you mentioned, that's a very huge concern because we spend a lot of time and we use the same circulated air, and also so it's a huge concern. And also not only the usual pollutants that we have discussed, there's a lot of asbestos and other material that the heat and all in our vehicles inside, so that we are exposed to these also. So yeah, so the filters are important, but also it's also important that we get some clean air to the vehicle also, that we don't keep the vehicle closed all the time and just we get in and drive all the time, but also we try and get some fresh air to our vehicle also whenever possible. That's also important, because even when a vehicle is parked for a long time, there's a lot of other bad constituents that can generate inside. So I think these are very important points. So yes, so we need to address these points as well. Yeah.